Hello everyone, once again welcome to my Oet channel. Today I came with Oet letter introspection of the exam 25 February 2023. Anyway, this letter was pretty easy because this letter is directed to family doctor, patient's family doctor. So it was a non-case. So there is no social paragraph. Even in the recommendation, there is no more recommendations. Only the present medical paragraph. You have to write the things, and the content also it is very less only. Anyway, we will go to the writing task. First, we will see the note what they have given. Assume that today's date is 8 January 2023 and you are the charge nurse. So we are the charge nurse at a hospital oncology clinic. So it is related to cancer. And the patient name is Mrs. Eliza Dawson. In some letters, I think the name is somewhat different. It was like Jenny Dawson, something like that. Then in the writing task, they have given that according to the case note, write a letter to patient's family doctor. Okay, so this is non-case and explain on preparation section and discussion. So they have planned something regarding chemotherapy or radiotherapy or something. So for that we have discussed already the things. Those discussion sections we have to concise and we have to write it as a formal letter to patient's family doctor. So this is the content of the letter. And the address is to Dr. Christine Baker, 183 Mount Road, Acacia Ridge, and Capri 3000. So this is the writing task they have given. And regarding the task, I mean, social history, they have given that this patient is 41 years old patient, female patient, a businesswoman, and works online. Father had congenital heart disease. Mother died with a heart attack and husband is a busy person, has three school going children. In medical history, they have given that patient has hypertension and on medication, high cholesterol and is on exercise, takes vitamin supplements. And then the incident, the story starts with 2 November 2022. She had nausea, vomiting, abdominal discomfort, and melena. Therefore, she got admitted in the hospital and underwent various blood investigations and X-ray. And in X-ray, nothing. They didn't find out anything. On after 2 days, on 4 November, she has undergone endoscopy and CT. In that, this cancer got revealed. Is therefore she was diagnosed with stage 3 bowel cancer. Um, at the same moment, she was got appointment for oncology nurse. That is ours appointment. And this is happening on 8 January 2023. So on 6 November, they have fixed our appointment for today. So chemo will be started on 15th January. So this is a planning what we are going to do for the patient. The chemotherapy will be from 15th January 2023. And so until this, we can concise and we can write it in the first paragraph. And the next paragraph, we can write about our discussion, what's happening today. So 8 January 2023 at oncology clinic with a nurse that's with us. First preparation section, actually she has to undergo 30 sections in total. And this is the first preparation section. We have explained on pre-treatment, blood test and purposes before the procedure. What all the blood tests are needed and what is the purpose of each test we have already explained. Side effects, that is the radiotherapy actually, it is going to be chemotherapy. So we have just explained about the side effects like nausea, vomiting, hair loss, constipation and a possible altered mental status, dehydration, as well as we have given the ways to overcome these all problems. Then we have shown the oncology treatment clinic also to the patient, as well as we have given the contact numbers in contact number for any concerns and queries. So these many things we have done today. That means just briefly we have explained everything regarding the 30 sections, and before the section what all the blood test is needed and what is the purpose, as well as the clinic we have shown, and regarding the possible side effects, as well as we have given even the contact numbers also. If they have any concern during the treatment period, they can contact with us. And in the discussion, We made aware of the treatment outcomes. This is a concise form. We made aware of the treatment outcome also, and during treatment, we encouraged her to participate in yoga and meditation, and what are the benefit about this yoga and meditation, as well as we have explained regarding the family support during this treatment period. Adherence to treatment is mandatory, so we have just explained to her, continue with all the treatment modalities in between. She should not quit the treatment. So these are the discussion what we had done today, and overall we have to concise and we have to write a formal letter to patient's GP. So this is the content of the letter. Actually, we can just write the introduction. It is nothing but this patient has been diagnosed with stage 3 bowel cancer, because it is a new condition. Then the requirement, actually the requirement, it is nothing but it is updates, right? So we can just write like we are I'm writing to refer this person to update the current health status of, like that. And actually the requirement, it's nothing but it is just explanation only. So the requirement will be just like we can tell that supportive services, or like support during the treatment period. That's enough, because during the treatment, if she need anything, the family doctor has to be help also, additionally with our help. So like that we can write. And in the first paragraph, the present medical paragraph, we can write about when she got admitted in the hospital. We can start with the 2 November 2022. Then gradually, what was the diagnosis, how it got diagnosed, and she was confirmed with our, she was appointed with our appointment, sorry, she was confirmed with our, or arranged with our appointment for today. Until there you can write it in one paragraph, and the next paragraph you can write about is all discussions, or all discussion we did, like that. And social paragraph, actually no need, because it is no, like non-case letter. And the recommendation, nothing, simply you can write that just we can request additional supportive services and further monitoring. That's enough. Okay, further monitoring and supportive services throughout the procedure period. So that's enough in this case note. Anyway, we will see the sample letter so that it will be clear for you. I hope when you will read this case note, it is quite normal. We will have some confusion regarding the requirement and even the recommendation paragraph. Anyway, we will see the letter so that everything will be we can made easy. Okay, thank you.